This is the second lecture of human body and orientation. First, I want to define the anatomical position. The anatomical position is a specific position with these characteristics. The body is erect, the feet are slightly apart, and the palms are facing forward with the thumbs pointing away from the body. That's important to note that the palms are facing towards the front of the body. The back of the hands are towards the back of the body. That's the anatomical position. We're going to talk about directional terms. These directional terms are terms that we use when we describe one body part in relation to another body part. This is used in referring to locations of particular body parts or locations of different lesions or pathological portions of the body. And it's terminology that we use to fully better describe where things are in the body. And basically, in anatomy, it's like learning a different language. And so these are some of the vocabularies that you'll need in the new language of anatomy. First of all, the difference in superior and inferior. Superior is toward the head of the body. Inferior is towards the lower end of the body. Superior in this case does not mean more important. It means higher, further away from the ground or further away from the floor towards the head, whereas inferior refers to closer to the floor when the person is standing up. Two other terms are anterior and posterior. Anterior is also another word for anterior is ventral, and another word for posterior is dorsal. Anterior is towards the front of the body. Dorsal is towards the back of the body. For example, the breastbone is anterior to the spine, the heart is posterior to the breastbone. And the way I remember this is think of the dorsal fin of a shark or a dolphin. The dorsal fin is the fin from the back. So dorsal means back. Other terms are medial, lateral, and intermediate. Medial is toward the midline of the body. Lateral is away from the midline of the body. Examples, the heart is medial to the arm. That means the heart is toward the midline from the arm. The arms are lateral to the heart. Arms are lateral, they're away from the midline compared to the heart. These terms are used when comparing one body part to another part in particular. Like we said, the arms are lateral to the chest. The heart is medial to the arms. You compare one body part to another body part. Intermediate is in between. The collarbone is intermediate between the breastbone and the shoulder. So it's between. Another two terms are proximal and distal. And this tends to refer to the position in the extremities, the arms and legs. Proximal is closer to the origin of the body, or a part where the limb is attached to the body. Distal is away from the attachment towards the body. So, for example, the elbow is proximal to the wrist. The wrist is distal to the elbow. The knee is distal to the thigh. The hip is proximal to the ankle. Those would be some examples of how to use proximal and distal in the correct term. Next, we'll look at superficial and deep. Superficial means towards the surface of the body or towards the skin. Deep means away from the surface of the body or away from the skin. The skin is superficial to the skeletal muscles. I mean, the skin lays on top of the skeletal muscle. The lungs are deep to the skin. Here's just some examples you can fill in and look at to practice using these terminology. I'll give you the answer for a few of these. The head is superior to the neck. The neck is superior to the abdomen. The abdomen is inferior to the head. There's two major divisions of the body. There's axial and appendicular. Axial, think of the axis is in the midline. It's the midline structure, so that's the head, the neck, and the trunk. Appendicular means appendages. Those are the limbs, the arms and the legs. And there's terms called regional terms. These are terms that define regions of the body. And some of these terms will be familiar with you, some may not be familiar. But these are all terms that you'll need to know for study of anatomy and used when to describe anatomic parts. For example, cephalic has to do with the head. Cephalic, there's the frontal, which is the forehead region, the orbital, which is the eye socket, nasal is the nose, oral is the mouth, and mental is the chin. Now, you might wonder why you need to learn these other terms, but these terms will be used throughout the semester in describing different muscles, different bones, different nerves. Well, I often use these terminology to help define locations of these other structures. So by knowing these names now, it'll make learning the structures easier in the rest of the semester. Move down to the next section. The cervical has to do with the neck. The thoracic is the mid portion of the thorax. So it's basically the portion of the body between the shoulder blades, and down to the abdomen. There's the sternal region, which is the breastbone area. The axillary region, which is the armpit. The mammillary region, which is around the nipple area. Going into the abdominal area. Abdominal is abdomen. The umbilical is the belly button. Pelvic area. The inguinal region is the groin. Pubic region is the genitalia region. Now when we look at the upper arm, this is part of the appendicular part of the body. Upper limb, the acromial. The acromial is named after a part of the scapula called the acromion, and that's the tip of the shoulder. That illustrates how by knowing that's the acromial region, you'll understand when we learn the scapula later on in the course that the process of the scapula that's in this region is called the acromion. So the names are similar. The brachium or brachial is the arm. So note that the brachial is arm. Antebrachial means forearm. Antecubital is the region on the anterior surface of the elbow. This is a common place to get blood drawn. When you go to donate blood or to get blood drawn from the doctor's office, they often draw it from this place, the antecubital vein, antecubital fossa region. And again, as I said, antebrachial is the forearm. Carpal is wrist. The term manus, M-A-N-U-S, refers to the hand. There's the palmar side, which is the side of the palm. The pollex is basically the thumb. And digital has to do with the fingers, the four fingers. In the lower limb, the coxal region is the hip. The femoral region is the thigh. This is named after the femur, which is the thigh bone that we'll study later in the course. The patellar region is the kneecap, which is called the patella. And so the patellar region is the area of the patella. The crural region is the leg. The fibular region or perineal region is the lateral portion of the lower leg from the knee down to the ankle. Pedal means foot. Like a pedal on a bicycle, you use your foot to pedal the bicycle. Tarsal is ankle. Note the difference. Carpal is the wrist, and tarsal is ankle. Metatarsal pertains to the foot. Digital, has to do with the four toes other than the big toe. And hallux is just another term for the big toe. Again, notice that hallux is the big toe. Pollex has to do with the thumb. And looking at the back, the posterior surface, we're looking at some of the same terms. First of all, the cephalic region is the head. Otic has to do with the ear. Occipital is the back of the head. This will be important because when we study the skull, we'll learn about the occipital bone, which is in the back of the skull. Cervical has to do with the neck. In the back, there's several regions of the back. The dorsum of the back is the scapular region, or the shoulder blade area. The vertebral region, which is the midline vertebral column. You have the lumbar region, which is the lower back area. The sacral region is below the lower back. The gluteal is the butt cheek area. Perineal is the region between the anus and the external genitalia. And in upper extremity, in the posterior portion, there's a acromial region again. There's the brachial region, which is the arm. So you see that both in the anterior and posterior section. Olecranon has to do with the olecranon process, which is a part of the elbow. It's at the back of the posterior part of the elbow. Antebrachial, again, is the forearm. There's the manus for hand again. Manus has to do with the hand. Metacarpal are the hand bones. So the metacarpal region is the region of the hand. Digital refers to the fingers. In the lower limb, there's the femoral region, which is the thigh. The popliteal region is the back of the knee. The sural region is the calf. Here's the fibular perineal region, which is the lateral aspect of the leg from the knee down to the ankle. The pedal region, or the foot. Calcaneal has to do with the heel. And plantar is just a portion of the foot where you plant your foot, the part that comes in contact with the floor, plantar surface of the floor, or the plantar surface of the foot. And when we study anatomy, it helps to think of the body divided into different surfaces or planes. A body plane is a surface which the body can be not literally cut, but you can imagine that if a slice of the body through these different planes, then you could see structures inside the body. And there's three planes that are important to know: the sagittal plane, the frontal plane, and the transverse plane. And I'll discuss the difference between those three. The sagittal plane is, imagine a sheet of glass going in between the body in this fashion here. It divides the left and the right sides of the body. If this occurs right in the midline, it's called the mid-sagittal plane. If this is not midline, if it's off the side of one of the midline, it's called parasagittal plane. So parasagittal is the cut is off center, not on midline. The mid-sagittal plane is cut made perfectly on the midline. The frontal plane, or the coronal plane, divides as if the sheet of glass is divided the body into front and a back. So the frontal plane divides the body into anterior and posterior parts. And the last plane is the transverse plane, or the horizontal plane. That divides the body into a superior and inferior, or top and bottom. This produces a cross-section of the body. So the transverse plane is a horizontal plane. If the cut is at an angle other than 90 degrees to the vertical plane, it's considered an oblique cut. We'll look at different body cavities. There's two main groups of body cavities. There's dorsal body cavities and ventral body cavities. The dorsal body cavity is divided into two categories. There's the cranial cavity, which encloses the brain, and the vertebral cavity, which encloses the spinal cord. Here's a diagram again of the dorsal cavity showing the cranial cavity here for the brain and the vertebral cavity for the spinal cord. The ventral body cavity, again the second group of cavities, was ventral body cavity, is divided into two sections. It's divided into thoracic and abdominal pelvic cavity. So again, a thoracic cavity, the cavity has two pleural cavities, one for each lung. Here's the pleural cavity here, and here's on the left side, right side, left side. The mediastinal cavity is in the midline, and the pericardial encloses the heart. Where peri means around, like a perimeter fence runs around their yard. Pericardial runs around the heart. Pericardial cavity means around the heart. Abdominal pelvic cavity is below the diaphragm. The diaphragm is what separates the thoracic cavity from the abdominal cavity. And this is abdominal cavities where the stomach, intestine, spleen, and liver are located. The pelvic cavity is lower than that, and that contains the bladder, urinary bladder, the reproductive organs, and the rectum. Here's again a slide illustrating the ventral cavity, ventral cavities, plural. These cavities are lined by membranes. The membrane is a double-layered membrane. The illustration is if you imagine a balloon and you put your fist in the balloon, there's two layers between your fist and the outside. There's the layer of the outside of the balloon, and there's a layer that's adherent to your skin. And that's kind of the way the ventral the cavities in the ventral part of the body cavity are aligned with the serous membrane or serosa. There's two types of serosa. There's the parietal serosa and the visceral serosa. And the difference between those two, the parietal serosa lines the body cavity wall. The visceral serosa covers internal organs. Internal organs are often called viscera. If someone's eviscerated, they've been cut and their bowels spill out. So viscera means internal organs. So this would be an example of if the hand represents the visceral organs, then the visceral membrane would be the part membrane adherent to the hand, whereas the parietal membrane would be the part adherent to the wall or the outside of the cavity. Now, in between these two layers, there's serous fluid. There's a space that's filled with serous fluid, which is a fluid secreted by both layers of the membrane, and it provides lubrication so that the organs can move and slide over each other without getting entrapped. Look at these different ventral body cavities. Again, the pericardium means around the heart. Peri means around and surrounding the heart. The pleural means side, and it surrounds the lungs. And the perineum is the membrane surrounding the abdominal pelvic cavity. So the pericardium refers to the membrane around the pericardial cavity. The pleural is the membrane, the serous membrane surrounding the pleural cavity. The peritoneum is the serous membrane surrounding the abdominal pelvic cavity. Sometimes these membranes can become inflamed as a result of illness or injury or infection. Example of that would be peritonitis from a ruptured appendix or inflamed appendix. It causes severe pain in this membrane, serous membrane. We can divide the abdomen into 4 different quadrants. This is mainly to make it easier to identify pathology. We divide into a right upper quadrant here, a left upper quadrant, a right lower quadrant, and a left lower quadrant. And we do that, imagine if you're in an emergency room and somebody comes in with abdominal pain. Well, abdominal pain covers a large area. It could be anything from the liver to the stomach to the intestines to the pancreas to the spleen. It could be in the intestines. It could be appendicitis. It could be any number of things. But based on which quadrant the pain is located, you can narrow down your list of possibilities of what may be causing the pain. As an example, I use these conditions here. Gastritis or stomach pain, you expect to see gastritis primarily in a left upper quadrant region because that's where the stomach's located. The pancreas is also located in this area here. So pancreas, pancreatitis, a problem with the spleen would also cause left upper quadrant pain. The right upper quadrant pain is the main thing that's in the right upper quadrant is the liver and the gallbladder. So you have a gallbladder stone causes right upper quadrant pain, or liver hepatitis. Right lower quadrant pain, that's where the appendix is. So appendicitis presents with right lower quadrant pain. But also there could be just inflammation of the intestines called a enteritis or a colitis from inflammation of the colon. The colon is in really all the 4 planes, so you can see pain in any of the 4 quadrants based on inflammation of the colon. The left lower quadrant area is primarily the intestines and the colon. So for each of these, determine which abdominal quadrant would you expect to find the pain of these organs.